Welcome back to part 3 of our Medicare Made Simple series. And in the first 2 videos, I answered the questions, what was Medicare? When did I sign up for Medicare? Who's eligible for Medicare? What is Part A? What is Part B? And so on and so forth. So you definitely want to go back and watch that video, and you'll be able to do that at the end of this video or anytime. Pause and then go search in our video section, and you'll be able to find Part 1. In Part 2, we talked about going on original Medicare, because when it comes to Medicare, you have 2 main options. You have your original Medicare, where you get Medicare Part A and Part B, and then you get a Medigap or Medicare supplement policy, same thing, a Part D prescription drug plan, and any other ancillary plan that you may need. And in today's video, I'm going to talk about the other option that you have, and that is Medicare Advantage plans. And this option is becoming more and more popular every single year. You probably have seen the commercials on TV. You've probably seen the advertisements on social media. If you're new to Medicare and you're getting ready to go on Medicare, you're probably getting phone calls like crazy and stuff in the mail that are talking about these 0 premium plans and that have all these extra benefits like dental, vision, hearing, grocery cards, over-the-counter cards, et cetera, et cetera. Well, we're going to dive a little bit deeper into that today, so that way you have an understanding of what a Medicare Advantage plan is. If you look here on the screen, it's also known as a Part C plan, which combines Part A of Medicare and Part B. And then most of them have a prescription drug plan included in there, okay? And they also have extra ancillary services like dental and vision, hearing, over-the-counter cards, gym memberships, and more. All right, so what is a Medicare Part C Advantage plan? They are simply ran by private insurance companies approved and under contract with Medicare. As already stated, they provide your Part A and B coverage, but can change different amounts for certain services. Cost for items and services may vary by plan. Co-pays or co-insurance percentage until max out-of-pocket is met. So most of them have what's called a max out-of-pocket, or MOOP for short, M-O-O-P, and that means you have co-pays and co-insurance up to that amount. Let me stop here for a second, because it's better to be on a Medicare Advantage plan, in my opinion, which in most cases doesn't cost you, the Medicare beneficiary, anything, and it has a cap on it. So like in our area, the average cap is around $6,000 for the year. And some people think, well, that's a lot. Well, it really isn't if you are not able to afford a Medicare supplement, drug plan, and any other ancillary plan that you may need. It's better to go on a Part C plan than it is, in my opinion, to stay on Medicare by itself, because you're responsible for that full 20% that's left over, and there's no limit on it. There's no cap. So at least on a Medicare Advantage plan, it's capped for you, okay? May offer some extra benefits, as I've already discussed. You still pay your Part B premiums in addition to your Medicare Advantage plan premium, if there is one. In most cases, there's 0. I get asked this all the time. Do I still have to pay my Part B premium? And that is yes. The only way that you can get out of paying your Part B premium is if you qualify for what's known as the Medicare Savings Program. And that is basically where they will pay, you're getting a form of Medicaid, and they're paying your Part B premium for you. If you feel like you may qualify for that, you can simply call the number on the screen. Either myself or one of our seasoned Medicare advisors would be more than happy to help you. This is at no cost or no obligation to you, and we can help you apply, or at least point you in the right direction for your local area. We work in most states, but if we're not in your state for whatever reason, then we have a trusted network of seasoned advisors that we can point you to make sure that you get whatever you need in regards to Medicare. Open enrollment, October the 15th through December the 7th. So, and these changes, whatever changes you make during that AEP, or some people refer to it as open enrollment period, happen on January the 1st of the following year. So in other words, one time a year, Medicare is going to give you the opportunity to review and reshop that plan that you're currently on if need be, okay? So this is very important that you review your Medicare Advantage plans every year, because these are 1-year contracts. So the companies could change what they cover in the formulary. The companies could change providers. The provider could, drop out of the network. And so, you definitely want to make sure that you're reviewing all of those things to make sure you're still going to be on the best plan. All right. So eligibility and cost of Medicare Advantage. Who can join an Advantage plan? You must have Medicare's Part A and B and live in the plan service area to be eligible to join. Here's the beautiful part about it. There's no health questions involved. And this can be a big deal for some that maybe for whatever reason were not advised correctly when they went new on Medicare, or maybe they didn't know there was another option like this option. And so therefore they never got on a plan, but now they're outside of their open enrollment window, which means on a Medicare supplement side, you would be guaranteed that plan. If you got that plan within your Medicare open enrollment, you get the plan with no health questions. Well, if you miss that, now if you try to enroll on a Medicare supplement plan, health questions are involved, which means underwriting's involved, and you could pay way more for the plan or be declined altogether. When it comes to Medicare Advantage, you do not have to worry about health questions ever. How much do these plans cost? In addition to your Part B premium, remember, we still got to pay our Part B premium unless we qualify for what's known as the Medicare Savings Program. You can usually pay one monthly premium for the services included in a Medicare Advantage plan. As you see here on the screen, typically $0. Each Medicare plan has different premiums and costs for services. It's important to compare plans in your area and understand the cost and benefits before you join. What we do here at Agape is we have a tool that we put in your zip code wherever you live, and it pulls up all the Medicare Advantage plans for the most part in your area, and it allows us to compare premiums. It allows us to compare benefits. It allows us to compare max out-of-pockets, co-pays, co-insurance, and so on. So this is why it's important. You want to put in your medicines to make sure that plan is covering your medicines properly. You want to get all your doctors in the system to make sure that your hospital, your doctors, any durable medical equipment people that you're working with, dentist, vision, hearing, you want to make sure all those providers are in the plan's network, because if you get on a certain Medicare Advantage plan, it could cost you a lot of money if you're not careful. Here's some Medicare Advantage carriers here in my local area and throughout the country. Aetna's a real big name, United Healthcare, Humana, Devoted, Cigna, Blue Cross. Obviously, there's way more carriers depending on which area you live in, but these are just a few that I'll name. So we never recommend that a Medicare Advantage plan be purchased or sign up for one by itself. And the reason is because there's a lot of gaps within the Medicare Advantage plan. Daily hospital copays. In my local area, those are about $300 a day, and some plans make people responsible up to 9 days, where if they go into the hospital today, they're responsible for that $300 for that time period. You have outpatient surgery copays. You have ER visit copays. You have ambulance ride copays. So we definitely recommend that if you get on a Medicare Advantage plan, also known as a Part C plan, that you get a reimbursement gap plan with it, or the official name is a hospital indemnity plan, because it will help shield you against those costs. And basically what it does is it just fills in those gaps, and it gives you a more comprehensive, more robust coverage. If you're on a Medicare Advantage plan and you're watching this video right now, and you don't have a gap plan like this, give us a call. The number is on the screen. This is no cost, no obligation to you. We'll review what you currently have, make sure you're in the best situation for you and your healthcare needs. We'll give you a quote on what these plans cost to work with your Medicare Advantage plan, and see if it's a good fit for you. If you're new to Medicare and you're going on a Medicare Advantage plan for the first time, this is something you definitely want to take advantage of and take a look at. Now, one disclaimer I'll give you is whenever you get on these gap plans, these reimbursement gap plans, underwriting is involved in most cases unless you fall into what's known as a guaranteed issue period for that specific company. All right? So this is not zero. Your Medicare Advantage plan zero, but your hospital reimbursement gap plan will have a premium associated with it. Let's talk about dual eligible plans just for a second. These are a Medicare Advantage plan on steroids, if you will. They're designed for individuals who have both Medicare and Medicaid. If you have Medicare and Medicaid, there is a special plan that you will want to go on. That's going to be the best situation for you. These are zero premium plans, unlike a traditional Medicare Advantage plan. They give you just more benefits. It just unlocks more benefits for you as the Medicare beneficiary. Once again, typically $0 for copays and all approved services. Typically offers increased additional benefit amounts, dental, vision, hearing, over-the-counter, grocery, and so on and so forth. So there's a special plan if you're on Medicare and Medicaid. All right, for veterans, if you're a veteran today, there is a unique plan or a special plan that you need to go on as a veteran. Typically, these are zero premium plans. They do not include any drug coverage because most veterans we work with get their drugs through the VA, and it doesn't interfere with their VA benefits. Okay, so option one, Medicare Part A only. Use the VA for all health care and prescriptions. Option number two, Medicare's Part A and B, eligible for Medicare Advantage plan, Medicare Supplement plan, TRICARE for Life, Part A and B is required. So you definitely, if you're a veteran, want to get this right, and you want to work with someone who's seasoned, who knows what they're doing in this area, so that way you don't mess up your veteran benefits. One of the biggest benefits that veterans like about these zero premium plans is that they have Part B premium give back options. For instance, one company in our area gives up to $125 back of that Part B premium, which is quite a bit of money over a year time. So a lot of veterans like that benefit. All right, when we compare Medicare Supplement versus Medicare Advantage plan, let's go down through pros and cons of both here, right? On the Medicare Supplement side, higher premiums, but no co-pays or co-insurance payments. In other words, if I'm on a Medicare Plan G and I may have a premium of, let's say, between $100 to $150, all I'm responsible for is that Part B deductible, which this year is $240 in 2024. So my red, white, and blue is going to pay $80. My supplement pays the other $20 minus that $240 deductible. So I have a little bit more skin in the game on the front end, but I have more peace of mind on the back end, especially if I go into the hospital and I ring up some major medical bills. On the Medicare Advantage side, generally lower premiums, but I have co-pays and co-insurance up to the max out of pocket. Remember, in my area here in North Mississippi, that's about $6,000 on average. So I don't have as much skin in game as far as a premium goes on the front end, but on the back end, as I go out through the year, I'm going to have a little bit more skin in the game, so to speak, when it comes to those co-pays, co-insurance up to that max out of pocket. On the Medicare Supplement side, one of the biggest pros of staying on original Medicare with a supplement is the freedom to choose doctors and hospitals. Pretty much everywhere takes Medicare, so don't have to worry about networks and all of that. Where on the Medicare Advantage side, they're network plans. There's two major types of Medicare Advantage plans. There's HMOs, which are very, very restricted, which means I have to go in the network unless it's an emergency. And there are PPOs. PPO just means I can go in and out of the network, but they charge me a little bit more if my providers are not in the network. Regardless, we always want to check doctors when it comes to a Medicare Advantage plan. On a Medicare Supplement side, no referrals necessary. On the Medicare Advantage side, referrals for specialists are rarely required. On the Medicare Supplement side, these routine services are not involved or not included on the Medicare Supplement with a standalone drug plan, such as dental, vision, routine hearing, over-the-counter benefits, things like that. Those are all extra plans that we have to get if we have some of those dental, vision, and hearing needs. On the Medicare Advantage side, may include extra benefits, and most of them are going to include that dental, that vision, that hearing, gym membership, over-the-counter card, etc. And then over on the original Medicare with the supplement and drug plan side of things, covered anywhere in the U.S., limited services outside of the U.S., and then on the Medicare Advantage side, emergency services covered worldwide. So there are pros and cons that we have to outweigh and we have to look at. That's why we definitely want to make sure that we get this right the first time. And the reality is, for some people, the Medicare Advantage side is going to be the best route for them. Maybe because of budget, maybe they're really healthy, maybe they don't take a lot of medications. But for many Medicare beneficiaries, the Medicare Supplement side is going to be good for them because many of them that are going on Medicare, or at least that we work with here in North Mississippi and throughout the country, many of them have health conditions. Many of them are dealing with something, and so therefore they want the peace of mind of knowing they're not as restricted. So Medicare Advantage plan gets a lot of bad flack sometimes, but they are not bad plans if you know what you're getting into, if you meet with a seasoned advisor who can give you the pros and cons and you understand all the nuances of the plans. So Transitioning from Medicare Advantage to a Medicare supplement. If you go on a Medicare Advantage plan, you have 12 months to go to a Medicare supplement on a guaranteed issue basis. 12 months from your Part A effective date. If you remain on the Medicare Advantage plan longer than 12 months, you would have to health qualify to go to a Medicare supplement. And there are two periods: the annual election period, October the 15th through December the 7th, and then the annual enrollment period, January 1st through March the 31st, okay, also known as OEP, open enrollment period. So this is very important that you understand that if for whatever reason, when you go on Medicare and you get on a Medicare Advantage plan, that you only have a certain limit of time before you can transition back to a Medicare supplement with no questions asked, because you could pay a higher rate, because now underwriting's involved, or possibly get denied altogether. Transitioning Medicare supplement to Medicare Advantage plan. If you go with a Medicare supplement, you can go to a Medicare Advantage plan any year you want during the annual election period, October the 15th through December the 7th. The Medicare Advantage plan would start on January the 1st. Example, if you decided you wanted to go to a Medicare Advantage plan this AEP in October through December the 7th, any change that I made there would start on January the 1st, 2025. Once again, one of the biggest pros when it comes to a Medicare Advantage / Part C plan is there are no health questions that you have to qualify. You have to answer to qualify for the plan. So we would definitely love to work with you and explore these Medicare options for you. Go even deeper with Medicare. If you have more questions, make sure they get those answered. Call the number on the screen. It's at no cost, no obligation to you. It's just going to cost you a little bit of time, and either myself or one of our Medicare advisors would be more than happy to help you. Once again, we work in most states, but if we're not in your state for whatever reason, we have a seasoned network of advisors that we can refer you to. Finally, take time to like this video, hit the like button for us. This just helps us reach more Medicare beneficiaries like you and get them this information so they can make the best educated and informed decision for their Medicare needs. God bless you guys, and we'll see you on the next video.